Okay, so good morning, Professor Terry.
Morning.
This morning I'm here to interview Laura, simply as we call her, and she's going to tell us who she is. And then this particular interview is about her experience with me during summer and on a bigger project from that internship now. So we'd like to hear more from Professor Terry. Laura, so who are you?
Okay, so I am Laura Terry, and I live in Fairfax, Vermont. I am currently a shared living provider. I provide therapeutic care and support in my home to individuals with intellectual and developmental disabilities. That's what I do full time. Um, so I also am an instructor through the Vermont State University, and I teach a variety of classes. I not only teach special education courses and education courses, but I have a focus on some of my classes involving multicultural um, curriculum and multicultural children's literature that talks about the cultural differences between countries and our country in the content areas of writing, reading, um, and also a human rights course that I teach. And I am also in the process of developing a culturally responsive teaching course as well from doing the work that I've done with Sefakor. So
Wow.
that's
Yeah,
what
I
I'm
think that
doing.
leads us to the next question
Yep,
about what your
yep,
internship was about. I just mentioned slightly that you had an internship with me during the
yep,
summer, but people
yep.
didn't actually. Do you want to talk about that?
Yes. So my internship with Sefakor, with you, was originally I was focusing on the different the different models of disability between different cultures. Because obviously we here in the western part of the world we have different cultures of disability than they have in Africa or in other countries. And I really wanted to work with Sefakor and understanding the different disability models that they have in Africa and how we can help people in Africa advocate, learn to advocate for themselves. Um, Also, how perhaps if if given the opportunity to look at different models, working together with different models of disability to help everyone's work around disability. And also, disability pride was another big thing for me. I really wanted to be a part of the disability pride um, movement that that Safakor has been so dedicated to doing in her work, and I also wanted to be a part of that. So that's why I did the internship, and I also, um, while I was in the internship, it broadened my journey. Um, so I am now looking into working more with immigrants coming in from Africa and working on public health, equitable health care, helping them take ownership for their own health care through that work as well.
Wow. So in other words, you want to say your initial goal has been broadened up. You have,
Yes,
and then
yes.
anyway, so if I should just ask a general question, how did this experience help you develop your career goals? Because I remember when we started, you came in with some strong goals to fit into the Learn program.
Hmm.
And that was the requirement for 30 hours with me, right? How did
Right.
this experience develop, help you to develop your career goals?
Yes. So originally, like I said, I was coming in to work with some different different cultures around disability and learning from people in Africa what their experiences were with people with disabilities and they they what their views and how they work with people with disabilities and how the professionals work and how the educators work. And that was an initial part of this through the LEND program. Um, but they expanded because I wanted to do more policy work I've started also doing a policy on, I just completed it, we're presenting it soon, on protecting people with intellectual and developmental disabilities during, or actually any disabilities during natural disasters, because many people are not given the opportunity to be a part of the planning and the preparedness, and therefore they're being, um, you know, they're not being attended to, and their needs are not being attended to. So that's a policy project I've been working on. Plus, now I want to do a policy project on immigrants coming into our country from Africa and how we can help them with equitable and respectful healthcare here in Vermont and in this country. And that's where things have expanded for me. And so I've also wanted to go to Ghana to learn from people from the ground up, um, in what, um, the work that we can do on the ground, because I know that in Africa, a lot of things are done with people, families, relatives, for people with developmental and intellectual disabilities, as well as physical disabilities. But I think it's important for people to know they can make a difference, even not having to just to go to a government or have funding available from an agency or a government. It can happen as on the ground, just as powerful as it can anywhere else. And the work that I do is work that people in Africa and other countries can do from the ground up, being a shared living provider and um, having people with disabilities live a life, be help them learn to advocate, help families learn to advocate, um, have, having everyone, even people with disabilities, whether you see them or not, being able to live a life, being um, able to be social, have friends, have experiences, be out of their homes, those kinds of things.
Thank you so much. Yeah. So we walked around the lands of Africa, about 5 different countries.
Yes,
And
we did.
yeah, I'm inquisitive because we work with students from UWC, that's University of West Cape, South Africa, Rwanda, Uganda, um, uh, Kenya, and
Kenya.
then the French-speaking countries. But the most important one, Ghana, right? I want to just pick on your mind. What did you find most surprising about the internship when we were roaming around all these countries
Yeah.
virtually?
Well, one thing I found interesting was the time that we were working with the University of West Cape.
Mhm.
Um, there was, these were people that had graduated and had disabilities. And they were in the course because they were given, or I said signed up for this course because they had disabilities and they had graduated from this course. But when you had asked them, when we were talking with them about their disabilities, no one wanted to acknowledge that they had one.
Mhm.
And it made me think that, this is the kind of thing that I'm so passionate about, is that people shouldn't be afraid to be who they are. They should be
Mhm.
proud to be who they are, whether that be, and we all have our challenges. We all have things that make us uniquely us. And I think that if you have a person that can't even doesn't want to acknowledge who they are, and disability is part of who they are, they should be proud of that. And for these
Mhm.
people that we worked with, they could not, um, even acknowledge, first of all, acknowledging it, not let alone talking about it. They couldn't even acknowledge it. So I would hope that my work also would involve a piece of helping people, um, come out, like be, I guess, slowly
Mhm.
be able to say, yeah, I have a disability. This is what it is. This is why I struggle with it. And these are my challenges, but yet trying to find a way that they can see that it's part of who they are and not to be ashamed of it.
Yeah, I think the shame, the the fear of ownership has been the general issue for people with disability, especially the invisible ones, and it's
Right.
so
Yes.
deep in Africa, and that has been a bigger journey for this our project in Africa with MasterCard. And I also want to also share that the fact that 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 period, like it was very mind-boggling for me because anyway, those are some of the things that when we met as partners, we talked about like how could that be? Because they were uh, given to us by MasterCard through InHive, all right, because they won the scholarship or they were sponsored purposely because they have one disability or the other. But the fact that they have even graduated as alumni and then they are still not having that ownership, that identity that we
Right.
are
That.
having, like
Right.
we have and we are proud of, and they are like,
Hmm.
they deny that I don't have it. Like it's very awful, very much.
Yeah.
Yeah, and it's so mind-boggling that somebody who is blind can tell you or deaf can tell you that, well, I don't see myself among those people, right? So
Right.
that is how bad stigma is. So that brings me to the next question I want to ask you about um, how you work with a team. Tell me how you work on a team and what were some of the roles that you played in a team of
Okay.
this. Yeah.
Well, there was one day when you were absent, you were out for a little bit, and I took on the role of um, kind of, no, actually, I think you were there at some point. You were there, and I ended up talking to them. I had questions I wanted to ask them, and we were chatting about. I was asking them about what interactions they had with people with disabilities, and if
Mhm.
they were professionals, what their roles were, and how they were helping people with disabilities and things like that, and what they're, they asked me questions. And one of the questions I happened to, well, one of the statements I happened to make was the reason I was so passionate about the work I do is because my daughter has an intellectual developmental disability. And I think everyone in the room, everyone on the Zoom couldn't believe that I was actually stating out loud that I had a adult child with a disability, developmental disability, invisible.
Mhm.
And they asked me, what were the chat, that must be really challenging. And, you know, it just brought it into perspective how different our cultures are. So in the United States, people who have disabilities, there's a lot more um, pride and a lot more people talking about them, talking about their challenges, talking about the disabilities, talking about their abilities, talking about it's part of who they are. And there's so much of that not happening in
Mhm.
countries in that, like in continents like Africa and in countries in that region. Um, and so I was I put it out there also that I also had anxiety, which is an invisible disability,
Mhm.
and that was making myself vulnerable to people who know that I have an individual disability that you cannot see.
Yeah.
But it's part of who I am, and I wouldn't take it away for anything. It's part of what
Mhm.
makes me me. And so having those conversations with all of those people, they would say I had responses like that must be really hard. But once I started to explain to them, like going out to an airport with my daughter, going
Mhm.
out to I have people who live with me with developmental disabilities, and we go out. I take them out into the public. We do things together. They have lives. They work, and that was a real um, surprise to these
Yeah.
people. And they actually said, we don't, our people who are disabled here usually stay at home, they don't really go out. And that was just one of the surprising things for me.
Mhm.
And that's why I'm trying to really focus on kind of, I mean, I know I'm not one person alone can end that, but I think by being a strong voice to help people know they have a voice and
Yeah.
that they can make changes as simple as their own homes or their own communities or where they live. That's pretty powerful.
Well, thank you so much for your commitment to this because one thing that I know very much is you came in with a different focus and it's like we went, I mean,
We went,
extra
yeah,
mile, and we are still
yes, we
going. Not
did.
that we went.
Yeah,
The reason why we are doing this interview actually is to open the platform for other people to know what you have experienced, how we used to wake up at dawn. I remember
yes.
4 o'clock,
4 in the
4
morning because of the time difference in Africa. And I loved
a.m.
it. I absolutely loved it, every moment of it.
I told people that my internship, when you're interning with me, people like you have to wake up around 4 a.m. because of the time difference. They're like 4 a.m. I say, yeah, those are some of the commitments
Yep.
that we had, and because you wanted to. Now, we want people to know about the details, about some of the things that happen behind the scenes. I mean, how would you recommend this internship to other students?
I would recommend this internship to everyone. I mean, people in school who have a goal of doing work, knowing, for example, that I came into this having no idea where I would be now. And so, and this internship has brought that to fruition for me because without this internship, without have enrolled in this internship through the Vermont Land program and doing the 30 hours, I would never have found myself even thinking about or even planning a trip to Ghana in the near future
Mhm.
with this internship, with this other internship that I'm doing
Yeah.
with the public health sciences internship. And
Hmm.
I'll be taking the health, disability, and intercultural connections with you.
Yeah.
And I would, that whole thing would never have come about if I hadn't taken this internship. So it just goes to show people that you have a goal in mind, yes, but you never know where that goal will go until you really apply it to like an internship. So try and do something you have a passion for or an interest for because you never know where that passion is going to take you. Because it could take you in a whole different direction that you never thought could be possible or you even thought you'd ever be able to do, and you can do it. So I
Yeah.
think that that's what's really important is these internships open doors for so many people in so many ways that you can't even fathom it until you're actually in the internship, which is how it happened
And
for me.
yeah, I remember your connections. I mean, in class, even
Yes,
though it was virtual, you feel like you have families across Africa now,
I
right?
do. I do. I have family over there now that can't wait for me to come.
And they are like, come
Can't
home,
wait
come.
to I can't wait to go and work with them and make more connections and be family.
I know.
Absolutely. Absolutely.
So I'm a bit inquisitive. What exactly are your next career goals in this journey? Now you did this 30 hours and
Hmm.
then you are implementing a curriculum for school to
Hmm.
teach, and then
Yep.
also implementing a project to implement for immigrants, people with disabilities in Vermont. I
Right.
want to hear more like some of the things that you are going to do in the future, especially how EAPD Africa's internship has opened your horizon and you're moving forward.
So it's interesting because I was thinking about this just this morning actually, and in addition to the work that I want to do in Africa and work with helping people there as well as like a shared living model as well as helping people here, people coming over from Africa, helping people with healthcare, equitable healthcare, and respectful and culturally respectful healthcare. But I also want to be able to reach out in the LEND program. Once you do this program, you can actually do a lot more. You can like I want to maybe present research at the TASH conference, which
Mm-hmm, mm-hmm,
stands for um, I always get this wrong. It's the severely the Association of the Severely Handicapped. So
mm,
TASH conference every year they have presentations and people who present and people who are doing work or research or their
yeah.
stories or whatever work they do. I'd like to
Mm-hmm,
also perhaps present there with all the work that I'm doing. Plus, I
mm,
also want to work um, as a fellow with Vermont Lend to help
mm,
other families with people with disabilities, people, immigrants coming in from Africa or other countries that need a fellow advocate to help them through their health care, through the public healthcare system. That's something that I also want to do.
mm,
So it would mean like working with teams of people like interdisciplinary teams where I can help um, people coming from other countries to receive the health care that they deserve and that they are entitled to, that
Mhm.
they should have, and be on their team because a lot of people who come into this country don't understand their health care and don't
Yeah.
know they have a voice in their health care. And so that's
Mhm.
something I'm also wanting to do as well.
Mm. Wow, you have a long way to go.
I know I do. That's right.
So, maybe I need help from you here, especially, this internship is behind the scene. I
Mhm.
didn't formalize it. I just know that every summer people intern with me, they have taking the courses somewhere and they just, as you know, I had students from American University, Ohio, University of Ohio, and all those people interning with EPD Africa, especially through the Global Disability Studies program from CES, but
Mhm.
I didn't formalize it. So there are so many hints here and there, but you have taken this course to the next level, especially after you have done, you are like, I need to continue. I need to do
Yes.
something about public health, disability, and intercultural connections. Like those were the things that you came out boldly to be
Yep.
the focus. And then you wanted to do it and do it well. Even though you finished the 30 credit and now you're like, no, there are a lot
I
to
want
be
more.
done
Yes. Let's be
outside
done.
there.
Yes.
Exactly. Um, this is where I need you. How can I improve? What do you think I can do to improve this internship? Even though now I think it is formalized
Hmm.
in a special way, but what are some of your ideas of improving this internship for people, not only students who are traditional students, like people outside, because you were
Right.
the student, right? Like people outside the school system
Yes.
who just feel like, well, I can be in my room and then go around Africa. Like every year, we have 5 countries to go and learn with people that we want to learn from or share with. So I
Mhm.
just want to pick your mind. What are some of the improvement you think I can do in this journey?
Right. Right. I think that one helpful piece, and I don't know how much control you have of this because it's like I said, it's behind the scenes and it might have to deal with a lot of the people who put these courses online. But for people like me, for the PACE students, professional and continuing education students, and students who are not enrolled as traditional students, it's harder for us to enroll at the time the when they start these internship programs. So,
Mm,
for example, I received scholarship money through a higher ability kind of healthcare directive, and I had the scholarship money that I applied for and received. However, the scholarship money is only available. They want it to be spent by May. And so sometimes when the curriculums, when we can't register, when the actual internships start in the summer, it's
mm,
harder for people like me to be able to use that money because if it's not used at a certain time frame, they'll take it back. Also,
mm,
so one recommendation I would suggest, if it's
mm,
possible, would be maybe to have people can do internships throughout the year. I mean, I know summer is a really big time to do it, and I think that's great. I think summer is a great time to do an internship, um, but they only allow so many people to
mm,
do the internships.
mm,
I know right now there's 5 slots available,
mm,
and 2 are already taken. So for me to get into that third slot, hopefully, I can't even register until well, it's now November 21st, I believe is the date. So I couldn't register with the traditional students because they're not allowed. There, I can't get into the system to do so. So even though I've contacted, you and I've let the director of the program know that I intend on doing this as soon as they open registration. So it would be really helpful for people like myself to be able to register earlier than
mm.
later, especially if we're getting financial assistance from
Support.
funds or scholarships and things like that. Yeah.
Mm. Wow. Okay. Yeah.
Yeah.
That is, as we made it very much official now in terms of registration.
Yes. Yep.
Okay.
Which is good. Yep.
Well, I think I promised you 5 to 10 minutes interview, but
Oh,
it's more than that.
that's okay.
But
That's
before
anytime.
that, before we go, I just want to see if you have any last words or yeah, your last words.
Yeah, I would strongly recommend people to take an internship, to do an internship with some place that you have a passion for, or if you have an interest in something, and even a spark of an interest, to do an internship, because that little spark can lead to so many great things that you never thought you would even do or even be able to do. And it can lead to so much for your own, not just professional development, but for your own life, for your own, for what you're passionate about in life. So I would suggest take an internship, do it, see where it takes you, because you never know. It can be amazing. And like it was for me.
Thank you so much.
You're welcome.
Yeah, I'm so happy that we made it to this day, especially as we plan to have a discussion one day about your process, your journey with me. And today we just had this time. I'm so glad that it
Me
happened.
too. I am
Yeah,
too.
I wish you a very fruitful journey. I know you are going to Ghana, especially in after the registration. And yeah,
Yep.
so
I
thank
can't
you
wait.
for
I can't wait. You're
believing
welcome.
in me.
Oh, absolutely. I believe you 100%. That's why I did this journey with you. And I'm so glad to be able to continue it with you
Thank you.
to Ghana.
Okay.